Hello, welcome to our webinar. We're going to get started. Welcome to everybody that has joined us. I'm Dr. Michelle Dillon. I'm a naturopathic doctor out of Charlotte, North Carolina, and today we will be talking about thyroid and could it be your thyroid. So I hope that you learn a lot and you're able to take more responsibility for your health and knowing all that we're going to talk about today. So if you have any questions, please leave them for the end of the webinar and we'll get started. So before we get started, I want to know if you know where your thyroid is. A lot of people don't. The thyroid is a little bow-shaped gland that kind of sits on where your neck meets your chest. And it is a really important gland. So what does it do? It does a number of things. Know that there is a thyroid receptor in every cell in your body. And so if you, there's a thyroid cell in every receptor in your body. So if you are having a thyroid issue, then it can affect every system in your body. It helps with metabolism. It helps with your brain function. It helps with weight loss. It helps with learning. A lot of low thyroid symptoms, which is more common to be low thyroid than high thyroid. But low thyroid symptoms are an inability to lose weight, memory issues, dry skin, constipation, to name a few, and immune issues. So people tend to get sick a lot. Know your hormones. So the thyroid has a number of hormones, mainly T4 and T3. Typically your thyroid, when your doctor runs a thyroid panel, a lot of times they're only running two markers. So they will run TSH and T4 possibly. However, I believe that you should run a more thorough panel, which we'll get to when we talk about labs, but know that TSH is the most commonly thyroid hormone that is run, but TSH is actually a pituitary hormone. TSH stands for thyroid stimulating hormone. It is typically what your primary care doctors run. And it just tells you, it's a pituitary hormone that tells your thyroid to kick out more thyroid hormone itself. When TSH is high, it's like your pituitary gland is screaming at your thyroid to kick out more hormones. So when TSH is high, it means your thyroid hormones are typically on the low side. And when TSH is low, then your pituitary is whispering to your thyroid, you don't need any more, no more hormones are needed. However, I run a majority of TSH with a majority of different other markers that will tell me if it's a pituitary issue. So sometimes a thyroid, you may have thyroid symptoms, but it's actually a pituitary, which is the gland in your brain that oversees, it's like the CEO, head honcho, manager of all your hormones. So that's why I think it's important to run multiple markers, because you can have I've seen it where it's totally normal thyroid, because the biggest pet peeve I have is people are like, well, my doctor run my thyroid and it's normal. It's not normal. It's usually suboptimal, and which we'll get to in a little bit, but a lot of times, so many times, people are, oh, everything's normal, but it's not normal, it's not optimal. I look for a more optimal range, and it's really looking at multiple different markers to determine exactly what is happening with your thyroid. So, and we'll get to it. I kind of get ahead of myself. So iodine is extremely important when it comes to thyroid. It is the Goldilocks nutrient, if you will, because if you don't have enough iodine, your thyroid won't work. If you have too much iodine, your thyroid won't work. It will be inhibited by too much iodine, and it would be inhibited by not enough iodine. So the main question for you is, how much iodine do you need? And the hard part is that what you need will change depending on what you're eating and your stress levels and the toxins in your environment. So the most common toxin that takes away your iodine is chlorine. And most people are like, well, I don't swim, I'm fine. But chlorine is if you're on city water of any sort, the city water, the tap water from city water is highly chlorinated to help get rid of some of the microbes that are found. And if you're taking a shower, most people take hot showers, and those hot showers, you're not only breathing in the chlorine from the steam, but you're also absorbing it in all the many pores that are open with your hot shower. So it's really important to get, if you have thyroid issues, to have, and you're on city water, to get a thyroid, to get a thyroid filter, to get a chlorine filter for your shower head. And you can get those on Amazon. Walmart usually carries them. There's a lot of places that carry it, but just make sure it's a chlorine filter. Other ways, so iodine in the periodic table, for those that may remember, if it shares a row, it's in the same family. So at the top you have iodine, then you have fluoride. So fluoride is another thing that can inhibit the iodine because it mimics iodine. So fluoride in the toothpaste. So trying not to do too much fluoride, as well as bromides. So bromides is another family in the iodine family. Bromides are found in baked goods. So when you have a lot of baked goods like pies and muffins and cookies and crackers and cakes, those can be high in bromide, and bromide mimics iodine. And so when you have bromide, chlorine, fluoride, all these things mimic iodine, your body absorbs it thinking it's iodine, but then it's not absorbing iodine because all those receptor sites are taken. So it's super important to make sure you're getting in a source of iodine, but not too much iodine. So you shouldn't have more than 200 micrograms of iodine. So check all the supplements that you're taking, make sure you're not taking too much, because that can inhibit your thyroid as well as trigger autoimmunity in your thyroid. So just things to think about for sure. Sources of iodine in food would be seafood, any kind of seafood, mainly seafood, shrimp, scallops, seaweed salad. Those are all good sources of iodine, but I think just supplementing is the best because most things that come from the ocean can be contaminated with a lot of chemicals and toxins. So I usually do a little bit of iodine if you go swimming, or if you're using bleach products. Those are another sources or toxin exposures. So thyroid and metabolism, if you have thyroid issues, you're going to have metabolism issues. If your thyroid is too high, you're going to over metabolize, and you're going to, no matter what you eat, you're going to lose weight, and you're going to feel sweaty and kind of like on crack all the time. You just feel really hyper, like hyperthyroid makes you feel hyper. And then hypothyroid, which is the more common, is where you just feel low and sluggish, and no matter how much sleep you get, you are tired, and no matter how much exercise you're doing or how well you're eating, you are gaining weight. So it's highly effective to your metabolism and your endocrine system. So the endocrine system is anything that secretes hormones. So it can be your sexual hormones, it can be your thyroid hormone, the ovaries, the adrenal glands. But the thyroid, again, remember when I said in the beginning, there is a thyroid receptor in every cell in the body. And so if you have a thyroid condition, it's affecting every cell in your body. Specifically, it can be affecting your hormones. It can be affecting your adrenal glands. So the adrenal glands are the little glands that sit on top of your kidneys and help cope with life and stress. And most of the time when I see a thyroid condition, it's really digging and investigating and running labs to determine what is the cause of the thyroid issues. Sometimes it's a mineral deficiency. Sometimes there's an underlying virus, which we'll get to. The virus creates inflammation and triggers the immune system, which can affect the thyroid receptors. Sometimes it's an overabundance of bad bacteria in the intestines, which is called dysbiosis. If you have an overgrowth of bad bacteria, it creates a lot of inflammation, which can affect your thyroid absorption as well. So it's highly effective. One new tip that I've learned is your cardiovascular system. So if you have a slow pulse, if you have a pulse less than 70, then you can have low thyroid hormones. If you have a pulse more than 80, then you can have too much thyroid hormone. And those that are on thyroid medication, it can get a little squirrely because you're on all this thyroid medication, but yet you're not absorbing your thyroid and you still have these hypothyroid symptoms. So it can get obviously complicated. So there's the thyroid and the immune system. So most, I would say 80%, 70 to 80%, research shows that 70 to 80% of your thyroid health your thyroid conditions can be caused by Hashimoto's. And Hashimoto's, 70% of Hashimoto's, which is when your immune system starts to attack the thyroid, 70% of those is stimulated by Epstein-Barr, or also known as mono. So I always, 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 always ask people that have a long-going thyroid issue is if they've ever had mono in their, if they've known of a mono issue. Most people will know, but again, hate to say 80% again, but 80% of the population has been exposed to Epstein-Barr or mono. So you could have been exposed to it, you have the antibodies, but your immune system's strong and vibrant and can take care of it. So you never had the mono. But yeah, most of the time, if you've had mono, it can highly stimulate thyroid and thyroid issues. So it's always looking at that. One of the main first steps that I do when I have a patient is looking over blood work. And in that blood work, I'm looking for patterns that can tell me, okay, it's more of a viral issue, it's more of a bacterial issue. There's certain differentiated cells that you can see, your white blood cells, there's neutrophils, there's monocytes, there's lymphocytes. I look at that monocyte number, and if monocytes are over 8, usually over 7, if they're in the double digits, then I definitely run a viral panel, and that viral panel will look for Epstein-Barr and cytomegalovirus, other viruses that can cause a lot of inflammation and affect your thyroid gland. So if inflammation is high at any point in any way, it's going to create disease. It's kind of like the seed that grows disease. And so my goal as a naturopathic doctor is to find the underlying cause of the inflammation, and usually it's some sort of infection. So whether it be a viral infection that's underlying, like a mono, or overgrowth of bad bacteria in the gut, which is pretty common too. So I do a lot of stool tests to determine that. And then it's just getting rid of it. So what happens when your thyroid isn't functioning properly? You just don't feel good. You feel sluggish all the time. You feel like you have to rely on coffee or a lot of stimulants. You can't remember anything. Your hair's falling out. You have dry skin. You can't poop. There's a lot of, because again, there's a thyroid receptor in every cell in your body. And so if your thyroid isn't optimal, again, we're looking for optimal levels, not just within the normal range of what the MDs run, you're not going to feel well. So the range for TSH is 0.2, 0.4 to 4.5, which is a huge range. It's like from under 1 to over 4. But I like that range between 1.5 and 2. And if it's not within that, then you got to run more tests and find out why. So common symptoms of the overactive thyroid: overactive, hyper. So if you have hyperthyroid, you're going to feel jittery, you're going to have sweating. Sometimes you get something where your eyes start to bug out because hyperthyroid, for some reason, you start to get a buildup of, I don't know if it's glandular tissue behind your eye, and you can have like a kind of a Bart Simpson or Homer Simpson kind of look. No matter what you eat, you lose weight, and you feel palpitations, sweating. Another symptom of when hyperthyroid gets too far in, it's called Graves' disease. And the interesting fact with Graves' disease is, well, I'm kind of getting ahead of myself, but usually Graves' disease is stimulated by a highly stressful event or ongoing stress over the years. Underactive is hypo. Hypo is low, when you feel low and slow, deficient. Most women, after they have kids, will have a tendency, if you have any thyroid that runs in your family, then you can have a tendency for having thyroid issues. And when you have thyroid issues, you can feel depressed. And some people feel depressed and anxious at the same time. Sometimes it's your hair's falling out, you feel just slow and lack of energy, fatigue, memory, can't remember anything, so on and so forth. Constipation, dry skin, everything's running slow. You have bradycardia, where your heart is, again, your pulse can be under 70 and run really low. And then you can feel cold all the time because you have low hormones. So I find as you get older, you just need some thyroid support. And if you don't have thyroid support, then you're going to start feeling these thyroid symptoms. another interesting thing, I've been doing more research on thyroid, excuse me, and I found that low thyroid issues, sometimes women with bladder issues, the first sign is actually with thyroid condition is a bladder issue. So if you have where you feel like you can't urinate fast or strong, if you have frequency in urination, if you have chronic UTIs, that can be actually a sign of the thyroid, because again, there's a lot of thyroid receptor in every cell in your body. And so if your thyroid's off, then girl, you're not feeling good. Also kidney, there's a relation with kidney function. So if your kidney function is, as you get older, your kidney function starts to decline. It's a high correlation with your thyroid gland and your thyroid hormone. So if your thyroid hormone is lacking, then you're going to have a lot of thyroid or kidney issues. So it's just all very interesting things. So if your neck feels swollen, so again, feel where your neck meets your chest, and just above that, that's kind of where your thyroid gland sits. Most patients I have, I will palpate their thyroid. The hard part is it's in your neck, and there's a whole lot going on in your neck. You have your carotid arteries, you have a number of nerves that come off your brainstem, and your brachial plexus in your arm that goes down your arm. You have your trachea, your windpipe, and then your esophagus that goes into your stomach. You have a whole lot going on. So sometimes it is hard, especially if people have chronic neck issues, to feel and palpate. But yeah, your neck can feel swollen. If you have had thyroid issues for a number of years, it's always very imperative to ask your primary care for a thyroid ultrasound, especially if you're over 50. The reason for that is, so a 50-year-old has a 50% chance of having thyroid nodules. So nodules are kind of like barnacles on a boat. The longer you're around, the more that you're going to have them. So a 50% chance of nodules for a 50-year-old, a 60% chance for a 60-year-old. A 70-year-old has about a 70% chance of having nodules. And those nodules are usually benign. Usually don't have to worry about them. But if they become naughty and they start to grow at an alarming rate, then you want to get it biopsied. And sometimes you can't feel the nodules. Sometimes they're in weird spots down here. But sometimes you may feel suddenly, oh, I feel like I have a lump in my throat when I swallow, or I feel like something's catching in my neck. Or, I'm coughing more because I feel like this pressure in my neck. Then I would say, okay, get a thyroid ultrasound. A lot of times if you feel puffiness or anything in that area, then I'm like, just ask your primary care for a thyroid ultrasound. And most of the time they will order it for you, because it's super important just to regulate. And if you ever have been told that you have nodules, you want to get a thyroid ultrasound every year just to keep an eye on them and make sure they're not being naughty. I have had a number of patients that had nodules, and we worked on that iodine balance. And sometimes with iodine, you can shrink the nodules down so that they're good nodules. So how are thyroid nodules diagnosed? Well, with the thyroid ultrasound, right? Nodules. But thyroid issues diagnosed is the blood work. But know that some people have something called subclinical thyroid issues, where you can have completely normal thyroid levels but have all the symptoms of thyroid. And usually know that things don't show up on blood work typically. They're not out of range. They're all normal when they're typical. But if in the blood work, usually things get really crazy off, out of range when things have been going on for a long period of time. So that's why I look for more optimal ranges, more conservative ranges when it comes. But most of the time it's blood work and then symptoms. And commonly they're underdiagnosed because, again, most doctors are only looking at thyroid based on that one marker, TSH, which is that thyroid stimulating hormone, which is actually a pituitary hormone. And they do everything off of that marker. But again, I've seen it where that was completely normal. You run the hormone tests, the T4 and the T3, and they're completely off, or they're low, or they're too high, or whatnot. So the lab tests to ask for are TSH, free T4, free T3, total T3, reverse T3, and then the thyroid antibodies. So they're called TPO antibodies and TSI. So they're antibodies to the thyroid themselves, and then there's antibodies to the gland itself. And then there's a few others, but most doctors will only run free T4 and TSH. But I like to run all of them because it could be a conversion issue. So T4 is what your body produces. The thyroid produces T4, and then the body has to go in and convert it to T3 to use it. So sometimes it's a conversion issue. So if you're low in selenium, for instance, you can't convert that T4 to T3. And if you don't have T3, T3 is what makes you feel good. Other times, if you have that dysbiosis or that overgrowth of bad bacteria in the intestines, then that inflammation can block the conversion of T4 to T3. Other reasons, if sometimes it's a pituitary issue. So if your pituitary gland is not functioning because of fluoride or like environmental toxins or too much cell phone use or radiation, there's a lot of different reasons. Then TSH can be off and your thyroid hormones can be off. So I'm just trying to explain that the markers just help me determine where in your body it is not working. And then you can naturally use things to help to correct it. Antibodies, if your thyroid antibodies are high, again, that's Hashimoto's, and that's autoimmune thyroid. If that is severely high, then usually I go and dig and find what it is caused by. Typically, it can be the Epstein-Barr or the mono that can be causing that. Sometimes it is environmental toxins. Sometimes it is that dysbiotic or the overgrowth of bad bacteria in the gut. It's just finding what it is for you and then working backwards to correct it and build the body up. So Hashimoto's, I kind of got ahead of myself, but Hashimoto's, again, is when your immune system gets triggered by a virus typically, and then that virus is floating around in your system. So let's say it's mono. The way I explain it typically is mono is like a little monster, and your immune system, when it's strong, when you're taking care of yourself, you're taking supplements, you're eating well, you're getting enough sleep, you're managing your stress, you're happy, your immune system's strong and can get that little monster and put it into a jail cell. However, if it's the holidays, I'm going to eat some junk food and sugar, and we're going to stay up late and drink wine, and we're just not taking care of ourselves, and COVID and all the political stuff, and then that jail cell gets open and the virus comes out, and that's when you start feeling super tired and inflamed and swollen and puffy and overweight. Because the immune system can't control it. And when your stress is high, your immune system's low. And when your immune system's low, then a lot of things can occur and Hashimoto's can be happening. And about 70% of most thyroid issues is autoimmune thyroid or Hashimoto's, unfortunately. But it can be reversed, and it typically runs in the family. Graves' disease is when it's hyperthyroid and it's kind of gone to the next level of hyper. And a lot of times how they treat that is they use radiation and radiate the thyroid so it chills out. But I haven't had many cases of Graves. Sometimes when Graves is really far gone, it's hard to control it. It's just kind of like a snowball that got away. If the snowball is as big as my house, I can't stop it with natural things. Sometimes you need to go in and get it radiated. Sometimes people have to have it surgically removed. But again, most cases of Graves, research shows that it is stimulated by quite a traumatic event or ongoing stress that you can't control. So that's why it's so important to manage your stress in a healthy way. So supporting a healthy thyroid, that's what we'll talk about next, what to do about it. Reduce the stress, right? This year has been interesting with COVID and a number of things with homeschooling kids and whatnot. So it's just important to, when you are managing your stress, you're reaching for things that are more healthy. So most people will reach for alcohol or they'll reach for the TV, but it's the more healthy habits you have, the less disease you're going to have in the future. So go for a walk, call a friend, drink a glass of water, do some stretching, yoga. I play my ukulele in my closet. Something that's healthy, that's going to kind of mellow you out. you know, making sure you're taking time. I know as a mom, it is hard to take time to yourself without feeling guilty, but know that if you don't do it, then nobody's going to do it. And if you don't take care of yourself, then nobody's going to do it. So you just got to do it. And then as you do it, it's important because you become a role model for your kids, and they say, oh, mom always did this. So when they're a mom, then they know that that's a regular thing that you should be doing. Going out with your friends, having fun, going for a walk, exercising, whatever it is for you, but, you know, making sure that you're reducing your stress, because it plays a huge role. It increases cortisol levels, which can make your gut more permeable and make bad bacteria grow in your gut. Um, cortisol, when it's high, it can cause that reverse T3, which actually changes the shape of your active thyroid hormone, which can affect the ability to absorb it. So all important things. So when stress is high, it can affect your adrenal glands. The adrenal glands are the little glands that sit on top of your kidneys and help you cope with life and stress. And so when your adrenal glands are deficient, it highly, highly, highly affects your thyroid. They're kind of two peas in a pod, the thyroid and the adrenal glands. So if one is struggling, then you need to support both of them, pretty much. Most people, I would say a lot of people, if they don't have Hashimotos, then a lot of the thyroid issue is caused by low adrenal glands. If you've been under stress for a number of years, some people, if they've been an athlete in the past, their adrenal glands are a little fried, especially if they're doing a lot of like endurance athletic work, because it takes a lot of endurance, and that endurance comes from your adrenal glands. So it's just important to make sure you're getting enough sleep. So things that support your adrenal glands are making sure you're getting enough sleep and making sure you're maintaining your blood sugar. So if you go long periods of time without eating, or if you're eating too many carbs, these all strain your adrenal glands. Also, internal infections. So if you have an overabundance of bad bacteria in whatever system, or viruses, that also puts a strain on your adrenal glands, which naturally puts a strain on your thyroid. So specific nutrients that you can supplement with. Note that this is I'm just going to talk about some general supplements that you can take, because again, I don't want to recommend something that you don't need. But fish oil is the easiest thing that you can add. Note asterisk star. Fish oil is something that comes from the ocean. The ocean is very contaminated. The bigger the fish, the more contaminated it is. So if you're getting a fish oil sourced from tuna, I would make sure it says on the bottle. So pick up the bottle and look at it. Sometimes you need a magnifying glass because the font is really small, but it should say it's purified for not just mercury, but heavy metals, PCBs, dioxins, toxins in general, because fish are contaminated, and when you make a fish oil out of it, it's going to be contaminated. So you may be paying money to contaminate yourself, which is inhibiting your thyroid anyways. But fish oil generally is a really good supplement because it lowers inflammation. And inflammation is the seed that grows disease. So if you can lower that inflammation with something like fish oil, it will help with your thyroid. Fish oil also is very helpful and effective in balancing your cholesterol levels. So if your cholesterol is too high, or if you're having issues with dry skin, the fish oil can help with that. It helps with the hair, helps with your brain. So fish oil is a good fat, and your brain runs on good fat. So if you don't have enough good fat in your system, it can highly affect your brain. So fish oil is a good addition. Typically, I like to recommend at least 2,000 milligrams. If you had any cardiovascular or cholesterol issues, I like at least 3,000 milligrams. So that's helpful. But again, make sure that it's filtered for contaminants, heavy metals, PCBs, dioxins, because if it doesn't say it on the bottle, they're not doing it, because it takes a lot of money to get that done. So I can post some resources after this, but feel free to visit my blog, because I have written a number of articles on thyroid. As we close up, you can feel free to call my office and do a free 15-minute phone consultation, and I'm happy to tell you how I can help and point you to somebody that can, if if I don't feel I can help. But most of the time, the 15-minute phone consultation is really effective, and I can point you in the right direction. So to kind of review, we talked about the thyroid, where it is, what it does, what labs to look for, what to ask your primary care doctor. We talked about nodules. We talked about Hashimotos and immune system and the adrenal glands. So know that I have been in practice since 2007, so I have plenty of experience with thyroid and thyroid conditions, and my passion is working with women and their families to help mom feel better so that she can parent better. So I'm going to open it up for questions. Oops, what happened to that? Okay. So let me open up my chat box and go from